So please welcome our CEO and founder, Mr. Jonathan Baran.
Thank you, buddy. Hello again, everyone. Hear me okay? Yeah, okay. So what we're going to do is I was tasked with putting together almost a state of the movement type of presentation. We're gonna go fast today. I got a lot of stuff that I wanna get through, but we're gonna do this in a couple ways. We're first gonna talk about where we're at, things that are going well, things that we need to improve upon, and then I'm gonna end with kind of a call for action here at the end. All right, so where's the movement at? This is just self-fund health, okay? So this is, remember, we're a health plan. Where are we seeing traction? Like, look at the map. The red dots tell you where the people are, right? So we are focused in the upper Midwest, Wisconsin, Minnesota, Iowa, and you see the gaps where we don't have much traction yet, right? These are the opportunities. Brokers in particular in the room, take a look at the opportunities, right? But the movement continues to grow, pick up steam. Over the past, this is really over the past year. So we've managed as an organization $25 million in total health plan spend. We've driven over $5 million in savings. I'm most proud of the number on the very bottom there. We have driven $6.2 million in business to organizations that probably would not have seen it otherwise, right? Providers that are actually doing the right thing, driving real value. And this is just our nurse team on the right-hand side. This is what engagement actually looks like. You saw the numbers on the last slide. We have about 5,000 members. Our nurses have had over 5,000 conversations with patients, right? This is the real work of healthcare. Getting engagement, driving adoption, right? So I'm also gonna give some shout outs, just big ones in the room, right? So number one, employers. Like, thank you for getting into this game, for being here, for learning, for actually starting to vote with your dollars, right? DPC practices, thank you for taking the leap, right? Many of these folks out here took the leap before it was cool, before they even knew that you guys were gonna come to them, right? And so that is huge, right? And the more DPCs that are jumping in, providing these great experiences to the communities, right? Another shout out for the folks downstream of those DPCs that are jumping in and saying, we want to offer fair prices, we want to put bundles together, we want to do all these cool things. Next, we cannot do this without our amazing stop-loss partners. Eric, raise your hand, please. So that TPAC, they are like, I cannot understate that they have been a shining light in this industry. This industry is messed up in a lot of ways, but they have enabled us. They're basically, their CEO has said that their goal by 2030 is to keep the cost of their entire book, how close am I on this, Eric? Like 2030, to keep the cost the same as they were in 2020, right? And so they're making real bets. Like, they are betting on us, they are betting on you guys, and it is not possible without them. And then we have others that are joining the fold too. An example, a recent addition to our kind of stable has been AccuRisk, another great group out of Chicago, but that group continues to grow. And then I'll have a shout out for the Yuzu team over here on the right. So folks at Yuzu have shown us what a great TPA looks like. I will leave it at that. So brokers, next up, we want to do some celebrations, right? I will make the strong argument that if the brokers change, this movement happens, right? And so fundamentally, you all in the room are a huge part of that. Who is leading the movement? So number one, shout out to a number of brokers up here. So basically we're showing you the people that believe in this movement so much that their employers are buying in. They're getting into the game, right? At the top of the list, Shay and Cammie. Raise your hand, please. Shay over there and Cammie over there. Leaders in the clubhouse. And so you'll hear today from some of these folks. Steen in particular works with Cammie. R&R Insurance. So these are folks over, if you are an employer and you need a broker on the Milwaukee area, private employer, those are your guys. Colton, are you still here? Colton. So Colton is out of Iowa, Minnesota, western side of Wisconsin, public, private, he's your guy. He works with Skip too, so I'll give a shout out for that. Alex at M3, who I don't think is here, but he's also a great guy on the western side of Wisconsin. And then Carmen, I know you're here somewhere. Carmen, right? A little timid, but public side too. So she works with a lot of public employers, right? And then just a number of other folks that have recently joined us on the movement, right? These are the people pushing this forward. The more that we get these folks, the more the movement grows, the more the team grows, right? So welcome everyone that has recently joined us on the broker side, consultant side. Thank you, thank you, thank you for pushing what you do. All right, now I'm gonna get to the tougher part of the conversation. Despite all the good work, we still have a lot of work to go. The status quo is pushing against us still, okay? And the first thing that I wanna show you is, so I've got two charts here. So on the left-hand side, this is from a stop-loss report that I pulled that was interesting, where it basically shows the highest costs that are hitting our plan, okay? And there is this belief amongst like everyone who's in the room in self-funds, you will get stop-loss insurance, right? The stop-loss insurance will kick in the event of something big. And your first instinct is like, when those things happen, is like, oh, well, that's why I have insurance, right? Well, wrong, because these are gonna be your future costs, right? And this is where TPAC in the room, like TPAC is literally paying these bills, right? And the more that we can help TPAC and other stop-loss partners, the more they can help us, right? So these guys are just as much in the fight as any of us are, okay? So I wanna make their problem is also our problem collectively, okay? So, but what I wanna point out here, what are the highest cost things? What are the highest cost things hitting our plan? So number 1, cancer. Number 2, heart. Number 3, ortho. Number 4, more cancer. Number 5, babies, right? And then here are some of the biggest claims that we've had on our plans. Hopefully, you guys, well, are not one of the employers that has experienced one of these, right? But this is the reality. Do you notice a common theme where the high costs are coming? Like which organization, right? And so this is where we have to do more to enable you all to succeed. Like we talk a lot about DPC, we talk a lot about the simple things like MRIs and getting those done, but the big things is where the big money is, okay? So what I wanna go through real quick is each of those areas in particular and address them one-on-one. So cancer. So we have, like, I don't know that you guys realize this, but like in industry conferences, when you go around the country, people are like, Wisconsin? Good luck. Like it's that bad. Like we are known as the state that like, oh my, yeah, there's nothing you can do up there in Wisconsin, right? And this is proof point, okay? Cancer. So cancer, obviously horrible, horrible. We want no one to go through it, right? But we have zero independent oncologists in the entire state. So all of them are tied up at big hospital systems. And what drives the cost of cancer, for the most part, is not the doctor, right? That's not what the expensive part of cancer is. The expensive part of cancer is the drug, right? Is the chemotherapy. And so what happens is you will get these very expensive chemo drugs that then at many of these organizations that you go, they mark them up 3, 4, 5, 10x. And so you're paying, as an employer, as a self-insured employer, you're paying anywhere from $10,000 to $20,000 a month for this drug, right? So there's no doctor involvement in the drug, right? You literally walk in, a nurse sits you down, you get infused into your arm, right? And so with cancer in particular, what you're attacking is the drug. And you're not attacking, like, from our perspective, keep your oncologists. We would love that, right? Now, the challenge that we run into is many times the health systems will play the games and say, if you don't use our oncologists, or if you don't get our drug, you can't see our oncologists, right? You can judge the ethics of that, right? But, so what we can do though, okay, is a number of things. So number one, what we end up doing because of this fact, the only options that we have for Wisconsin employers, so Illinois Cancer, so they're in Northern Illinois, right? And then Minnesota Oncology on the drug side. Okay, so for those on the western side of the state, that like these are the closest options that we have for independent oncologists where we can get fair prices. Now, I will also give a shout out to Solstice and Renovo, who are certainly out there. And in many cases, they can get these drugs and infuse these too, right? It's on a case-by-case basis. But Dr. Tim, I don't know if he's in here or not, but Dr. Tim will tell me he's an anesthesiologist. He infuses drugs for a living. Like, this is his world, right? Now, in addition to that, you see these logos on the bottom, is we are increasingly, when we need really high-end care, so I'm talking like you need something that's going to cost you $100,000+. We're increasingly using health systems outside of Wisconsin, right? And you can see some of the names on here: Johns Hopkins, Cleveland Clinic, University of Illinois, Chicago, right? Because these organizations are actually willing to offer fair prices, right? I'll give you a recent example, employer in the room I won't name, but we had a patient going into Pro Health for a back surgery, right? Inpatient back surgery was going to be about $150,000 locally, right? Cleveland Clinic was offering the exact same thing for $50,000. Cleveland Clinic versus, like, those are some real trade-offs, right? And so for those of the folks that are on our plan, or even if you're not on our plan, we are happy to freely give away all of everything that we are teaching here. But there are options for your members at many of these organizations. And so if you hear members that say, like, we've got something upcoming, make sure to bring this up. This is on the cancer side. On the orthopedic side, I would say in general, it's a much better story because we have a lot of options, and increasingly, more and more options are kind of getting in the game. So just shout out for a couple folks that we have done a fair amount with. So Ortho Illinois down in Illinois, or Northern Illinois, Solstice, of course, OAW, who I think is here as well, Renovo, Twin City Orthopedics. These are great options for fair prices across the state, right? And again, more organizations are getting into the game, seeing this movement grow, and making it happen. So, and then the challenge on the orthopedics side comes when you need a big inpatient stay that's tied with that. And that's the same type of things are in play here, where you need big ticket items. You have to be educating your members that they're going to be getting options outside of the state, because the reality is, at this point, that's what we have to do to find, like, high quality, low cost, right? New program for those. So you saw our biggest claim was a premature baby. So that's the biggest claim Self-Fund Health has experienced, is a $2.1 million claim at Mayo Clinic for a premature baby, right? And so a program that we're putting in place, that we're starting with all of our plan going into 26, is a program where we're going to incentivize the use of preferred birthing centers with an incentive of free diapers, right? So free diapers for a year on the program when the member chooses to go to an organization that is a preferred option, really. And what we're solving for with that is two things. Is number one, for those events that do end up in premature births, like, we want to try to address those. And then even for the low-cost events, there is a fair amount of variance with organizations and how much those childbirths cost. So this is just a shout-out for everyone who's currently on our plan to know that this is coming. Your teams will be sharing more with this with you as we get closer to the start of the year. Okay, now I want to get to part of the conversation about where I am coming at this through as an objective lens as possible, is what we need to do to push this movement forward more. Like, if we collectively want to see that flywheel, remember that flywheel that I started at the beginning? If we want that to turn faster, what are the things that we need to do? And I'm going to address each entity separately, including us, okay? Now, I just hope you hear what Ben said, that I am doing this to push the movement forward. I am not here to call you out as individually. I am not here to attack you. I am trying to call out the behavior that is leading to the outcomes that we do not want to see, okay? So I hope you do not take any of this personally, but I hope you see this in the spirit of what I'm trying to do, because at the end of the day, you all are the 1% here that are actually doing something about it, okay? So first and foremost, employers, I'm kind of putting you on the spotlight first here. Okay, I have some rather wordy slides here, but my intention, I kept it wordy because I actually want you guys to hear this concrete feedback, okay? So number one is that in general, employers, you want change without change, okay? Like this is first and foremost, is like you come to us, you come to your broker, and you say, this doesn't work, we need something different. And then when we talk about new things, you're like, well, that's too much change, right? We can't do that, right? And so this is the type of thing, my format here is gonna be like, what do we see, what it means, and then what the great ones do, right? And you obviously here, folks realize that change is gonna come with change. And we have to do something different if we want things to change. Second piece, you hide behind HIPAA, right? We hear this all the time, is like, oh, I can't know that. You can't tell me that. I don't want to know that. Don't tell me about my patients, or don't tell me about my members, right? And this thinking, so HIPAA is not a law that you as your as a plan sponsor you are able and willing to see PHI, right? What HIPAA says is not saying you can't see PHI, it says you have to be responsible in your use of it, right? It means you can't do things that would be unethical with viewing that data, right? And so employers, you should train yourself on the use of HIPAA, but it doesn't mean that you shouldn't, I would argue you have to see it to do your fiduciary responsibility, which is to manage your plan, okay? That's the second piece. You're afraid of real conversations, right? So this is, what I mean by this is that oftentimes within healthcare, things get personal, right? And there are gonna be things that come up that most employers will shy away from entirely. And they'll say, I don't wanna have you basically tell us, you won't say these words, but you'll say, I don't wanna have these conversations, you have them instead, right? And at some level, we will do that, but it's going to be, many of these conversations reach a point where you have to be, we have to have your engagement. And we have to have you help us. And without it, we're leaving the real change on the table, right? So these are the members that refuse or are obstinate or don't want to listen to us because they think we're the insurance company or something like this, right? We are not the insurance company. You are the insurance company, right? And so when these members realize that they're not saving money for us, right? They're saving money out of their future paychecks each time you drive this change, right? These are the types of things that are really important. You ignore bad risk. So what I mean by this, there are two levers on your plan, right? The first lever is the people that come on your plan, right? The people that join your little insurance company, right? Your self-funded health plan. And you oftentimes ignore this, meaning, I'll give you some examples here in a second, but you have to address the risk on your plan because in some cases, you're just not gonna be able to do much in the absence of it, right? So these are members that are gonna be high cost that you have to do something differently about if you wanna address. So I'll show you what I mean by that in a second here. You blame your brokers for big increases, right? Brokers, I'm trying to back you up here, is that we do not, your broker is not responsible when you are self-funded for how you're, for ultimately the choices of your members, right? Ultimately, when you're self-funded, you get all the control and the ability to drive the change, and the broker is a part of that team, but they are not solely responsible for that team. You are ultimately responsible for your plan's performance. We want to enable you to think about that differently. We already touched on this. The stop loss is not stop loss's problem, or high claims are not only stop loss's problem, they're your problem. No focus on education outside of open enrollment. This is a big thing, a big theme that's gonna hold true here. Everyone, let's be truthful, everyone realizes that people don't care about healthcare until you have to care about healthcare, right? And you can't assume that people, when they hear that one message in October or November, that's it, right? If I could wave a magic wand, I would kill open enrollment meetings altogether because it's just a one point in time, right? People need healthcare throughout the year and that's when it's gonna be relevant to them. No financial oversight, right? This is your second or third biggest plan spend, or healthcare is your second or third biggest item in your spend, and your CFOs, your decision makers are not involved in it, right? You will hear from others, Steen today, who will share a CFO's perspective on this, but that's an important piece, okay? So again, employers, I hope you hear what I'm saying and hear some of this feedback. Now, in particular, we have a POMS team, so our plan outcomes team. And their job here is to work with you all as the big ticket items come up throughout the year. And so each one employer that we work with is assigned a member of that team. And their goal is to help you improve. Please meet with them. Please spend time with them. And another important item is they're going to start flagging opportunities for you when there is a member that is going to save more than is going to spend more than $25,000, and we have been unsuccessful in doing something with it. That is our call to you to say, we need you to engage. We need you to do something. Please jump in and help us here, okay? And so this is your opportunity to lean in. Many employers you've already seen this, but this is your opportunity to drive real change, okay? In addition, you're going to hear from Yuzu later today. They're going to give you a demo on the portal side. All employers that we work with have access to a portal where in real time you can see your claim spend and see what's going on, okay? I would say our best employers are in that with regularity, right? And if you go into this, again, Katie will show you this later, but you can go into the claims tab and you can literally sort by plan pays, and you could see what are the items that are hitting your plan, right? And then my call to action to you is like, start asking questions. Get in there. Like, what was this? And like, ask our team, like, why did we spend that? What do we do about this drug, right? What do we do about here? Like, manage this like you would manage any other cost and expense in your company, right? And again, you'll kind of get a demo of this later today, where we'll walk you through this. This is a slide about managing that risk. So again, when I talk about the risk that is on your plan, and this holds whether you are self-funded today or whether you're fully insured today. So even if you guys anyone in the room doesn't work with us, this feedback all applies. Like, the risk that is on your plan is your risk no matter what. And meaning, if you have high-cost individuals on your plan, you are paying for them whether you are fully insured or whether you are self-funded, okay? So I would say first and foremost, number one is the Medicare side, right? This is just it drives me nuts because every single one of you in the room today, between 5 to 10% of your population is Medicare eligible, but they're on your plan, okay? And so almost always what is happening there is that the member who is on Medicare they just assume that because they're still working, they should stay on your plan. And if you drive regular education sessions with them, like, they just need to be educated on what Medicare is and how it works, and then they get off your plan, right? What is the highest risk to your plan? It's just members who are 65 plus, right? That's your highest risk. Your brokers, call to action please, is like, if you work with employers and you support these, and you have members of your team that support the Medicare, like, bring them in with regularity. Minimum once a year, you should be doing this, minimum, right? I think we actually have a organization outside too, in the hall that just does Medicare education, and you should talk to them. Like, because most organizations can knock 5 to 10% of your spend just by doing that with regularity, okay? Number one. Number two, high-cost members. Some of you have seen this already. We're gonna talk to Michael Best later today. Michael Best is kind of like I view them as kind of like a SWAT team to help you address high-cost members, okay? And so two that we see with regularity. So again, number one, Michael Best, you hear from them. Another one that some of you may have heard of is an organization called Samaritan Fund. These are organizations that basically work with members and nonprofits to then get the members onto an exchange plan, and then subsequently address your risk, right? Final call out at this moment, for folks that work with us, you will hear this from your plan team or your plan outcome manager, is that FMLA, right? I cannot emphasize this enough. You have to make sure your handbook is, one, tight and up to date, and that you are following the policies without exception for leave, okay? Because we have organizations that will say, Bob has been a part of the team for 20 years. Like, we're going to take care of Bob. Bob, don't worry about FMLA. Like, we got you, right? You are setting yourself up for failure if you do not follow that process. It is very important that you do. And our team can get in and explain this in particular as we move forward or if there are questions. But that's just kind of a final call out on that. New program, again, that we're also going to be driving this year is for any employer that refers another employer. So again, a big part of our movement here is we need more employers in the game to drive more of the activity that we are talking about today. And so the program is, for if you are an employer and you refer another employer who signs up for Cell Phone Health, you get $5 per employee per month off of your costs. So a maximum of 3 employers you can refer, but the idea is that you're going to get the $5 off and the employer will get $5 off, right? So again, we want to incentivize this behavior where the more employers we get in the game, the more providers we get in the game, the more brokers, consultants, everyone that's going to start to push this. So practically, again, for everyone who's cost conscious, so if you're a 50 life group, you could save $3,000 up to $9,000 down your number of employees, right? That grows. Shoot us an email, rfp@cellphonehealth.com, and we will track anyone that you send a referral to. Like, just send us a note that, hey, I'm referring this group to you guys. We'll keep track of it, and if they do sign up, again, we'll give you that. We want to enable more employers to get in the game, and we're happy to do that. You don't also yet have to be a customer to do this. So if you are considering Cell Phone Health, you may make that decision in January. You can push that forward too, and we'll give you that credit. And for us in general, good employers are at least 50 employees and up in Wisconsin, Minnesota, Illinois, these types of regions. Okay. Okay. Brokers. So that was all the employer side. Broker side, I want to switch this over to you. Again, I view you all as the key, as the key. And so for those that might not understand why I'm saying that, is because we actually work with brokers to reach employers, right? So generally speaking, we do not work directly with employers. We work with brokers, consultants, who then, mention us and bring us up, okay? So, but I have to call out the things that I think are preventing this movement from moving forward within your behavior, okay? So the first is fear or lack of understanding. So it is quite common for us, and when I'm talking about this, I'm not just talking about Cell Phone Health. There's many ways that you can participate in this movement, but many of you, because of usually, like, again, fear, lack of understanding, you don't talk about this. It doesn't get brought up to employers. There are many employers that never hear the message that we are presenting from their advisor, right? And so it's because you're concerned that you're going to get fired for doing the wrong thing. And this is where I need to ask the employers to have grace for everyone here, because at the end of the day, the brokers that lead with courage, that push this out there, they're going to put their necks on the line a little, right? Shay, I think about you as I'm saying this. Like, she put her neck on the line a little, because she was one of the first. I say that because she was one of the first that ever sold a Cell Phone Health plan, and she put her neck on the line, right? And that took courage and that took bravery, right? But we are also here to help. Ben and his entire team are focused on education and learning and understanding. This is a complicated world, right? And we're just trying to get the knowledge out there, make it happen as best we can. Speaking on behalf of employers without engaging them first, right? This happens a lot with us, where we talk to an advisor and they'll say things like, our employers are not ready for that, right? We're gonna crawl, walk, run to self-funding, right? Or that organization's really paternalistic, right? And what I want you to hear is that from our perspective, we hear employers are much more open to change than you think. They're at their breaking point. They need to see all the options, right? And by any sort of like defensive measure or like, kind of guarding them, I think you are doing the employers a disservice, because they need to understand, they need to learn and appreciate all these different things, right? Point solution obsession. We see a lot of this in market, right? Where we're not addressing the real problem, which is the healthcare spend. What we're doing is we see a lot of pushing of specific solutions, so like specific stop loss, a specific PBM or TPA or carve out or captive or vendor as like the fix, right? This is not how we fix healthcare. We don't fix healthcare by buying insurance in a different way or buying a component in a different way. We fixed healthcare by spending less on healthcare, right? And so the challenge is, and this is the truth, is oftentimes, but not always, there is incentive, like the broker is getting paid in some way off of these. That is not many of you in the audience, but that happens, right? And so you always have to be understanding of where those incentives are flowing and how they are flowing to understand why you are hearing about things and not hearing about others, right? And that's where we would say our focus has to be on the behavior change that drives a difference in actual plan spend. Okay, a couple more. Bad incentive alignment. So unfortunately, we hear about this often where I would say that this, largely speaking, does not happen at the individual broker level, but many of you may or may not know, employers in the room, carriers, big carriers, like the big ones, will pay agencies what are called overrides, which are basically based on their entire book of business, they will send more money their way, right? And so as a result of this, we experience friction in market where brokers are hesitant to bring us up because that means they're losing money that you might not see elsewhere, right? And so again, not many of you in the room, but like this is a barrier that we see to this movement pushing forward, right? And we also see where there's a behavior of if a broker cannot exclusively own our solution, like exclusively offer our solution to employers, they will also not talk about us, right? And so this is, I'm enabling you all with power, right? Employers, and then I'm also saying for brokers, like we want, ultimately at the end of the day, we want everyone to win in this model. Brokers have to win, employers have to win, providers have to win, everyone has to win. But I want to drive as much as we can towards incentive alignment. Let's just get the incentives tied to the right in the right way, meaning like get the employer, get the broker aligned towards driving plan performance, right? And I think all the employers in the room would agree with me that if you paid everyone around the table based on how well your plan performs, like you would feel really good about that, right? And so that's a really important piece that we're going to continue to see us push on. Brokers step back after the sale and focus entirely on the renewal, right? This is where I need the biggest support, continued support, is that we have this, we go through open enrollment and then not much happens after that. We need that to change because we need active involvement throughout the year. And so my ask of the broker community would be to say, I want you to own with these employers, driving communication, staying on top of communication, driving this forward each and every time you meet with them. How do we get more people to the DPCs? How do we run a health fair with as many of those people outside as possible to get them familiar? Or how do we figure out a strategy to engage that one member who's driving so much of our plan spend or so much of our issues, right? Drive savings and education constantly, right? And then just one final piece is filling the year with kind of like look busy tasks, right? I want, as much as possible, I want everyone focused on the latter half of this, which is how do we drive ROI for the health plans that we work with, right? Every activity can we tie back to ultimately something that's going to have an impact on cost or quality within the plan? That's what I would want everyone focused on. All right. Sorry again for that uncomfortable part of that conversation, but again, I wanted to get some of these out there. I skipped over one here. DPCs, you're next up on my hit list here. Sorry. Okay, so DPCs, we love you, but a couple things. Number one is ownership of utilization, right? So what I mean by that is the way that this movement is working right now is that many of you are getting paid for members that you're not seeing, okay? Now, So meaning you're a 100-person employer and you have 50% of people are using you, right? I need you to drive as much ownership of that utilization as you can. Drive it as high as you can, right? And get creative, right? How do we figure out how to work with each employer in a way that gets as many members to you as possible? I've had really creative DPCs that'll they'll say, hey, can I get access to the manufacturing floor? Can I walk around and just shake hands and just introduce myself? Employers love that, right? We've had DPCs run a special event where they invite everyone to the country club or something and run an event, right? Get creative with it, but we have to then figure out how to drive more of that utilization. Our plan outcomes team is going to work with you on that as well. Lack of analytics investment. So what I mean by that is many of you, DPC, one of the cool things about DPC is that we resist tracking data because many of you came from the hospital and the medical record world where you were having to record all this stupid stuff that was not relevant to your practice. And so you said, enough, I'm leaving, I'm starting, I'm going to do this my own way. Now, that is great, but we still need to invest in analytics in a way that we can enable these employers to take action, right? So a simple measure that I care a lot about is just utilization. What percentage of members are using the service, right? And that's just a very simple analytics measure, but we need that increasingly from you. There's an organization here, Health Compiler. Mahul, are you here? Maybe not here. So there's an organization, Health Compiler, that we're looking at piloting to work with DPCs to provide better analytics, pulling these automatically from your EMR. Low ownership of high-cost members, okay, is, I would say, that so almost all of you, right, have members that are not yours, or maybe that are currently your patients that are driving substantial claim spend. I would love for you to lean in more around these, focus on some of these high-cost members. We'll get you access to claims data, and you'll be able to see what is driving the plan spend, but help these employers lean in, but you're the provider, right? And ultimately, as much as you can help drive that, that's gonna help us even more. And then final piece on here is ancillary expenses. This is kind of an edge case, but one that I do think is important, particularly for those that are offering ancillary services, labs, meds on top. The trade-off that we are making by you not sending in claims is that we don't usually see an itemized breakdown of your expenses, right? And as a result of it, the trade-off that we are making is to say, if you are having ancillary expenses, please do not apply markups on those expenses because if we don't have that visibility, then employers are going to begin to question those prices. And now we're back to the old world that we're trying to move away from. My strong preference is make all your profit, make what you need in your subscription fee so we can keep these clean and we don't have to worry about ultimately the costs getting out of control in the same type of way. All right, one more on, us. So I put this in the category of the innovators, right? Disruptors, whatever you want to call us, right? This is not just us in the room here. What have we done wrong and where are we trying to be different here? Is we are not for everyone. This model is not for everyone. This is not a silver bullet. Self-funding is not the answer, is not the only answer, or is not a guaranteed answer. Let me say it that way. Self-funding gives you a lot of the tools, enables you to do the things that we're talking about today. But I think in the past we have positioned this as it's the silver bullet, right? And there are a lot of good things, but there's also we're not the right fit for every employer. I think you guys have gotten a good flavor of that. We still make this as an industry. It's far too complex. We try to simplify this as much as we can. This is what we are trying to do, make this as simple as possible, but it is still way too complicated, and we put complex jargon in cases that we don't need. I will also call out our marketing tone. So some of our marketing tone, I have heard that many of you have felt attacked or maybe not you, but some people in the industry have felt attacked when I say things like I have been. Again, I am not calling out the individual. I'm not attacking the individual. I'm calling out the behavior so we can know that what is getting in the way and then what we have to take as a movement to fix it. And then partner selection. This is certainly, I think all of us have gone through experiences where we have aligned with vendors that have not been the right fit. And we need to implement stricter vetting processes, make sure that we have the right organizations, because ultimately, to do all the things that we were talking about is very complex, and you really have to have the right people behind you to make it happen. Leslie. So Leslie, so anyone who's not met Leslie, you should. I asked her, I said, Leslie, I have a presentation kind of on the state of the movement. What are the things that you would want everyone to hear? And she comes from the same spot that I do, which is like, the truest of intent is like, how do we push this movement forward, right? So Leslie, this is what she said about employers. I think Steen is what you're gonna hear from him later, is a really good example, and people should copy what he's doing, which is digging in, asking questions, following up, and ensuring people are getting good care. I think that can be perceived as overstepping, but I wish that more leaders did that. I wish they put people on their radar, or they put people on our radar so that we can try to engage with them as well. If someone looks like they have been putting off their health on hold, let the nurses know, and let's work together to set up some time with the employee to figure out what they need and get that going, right? She's saying, lean in, right? Brokers. I think brokers need to take more of a lead. They are so passive. They are not doing anyone any favors by trying to be leadership's bestie. DPCs. This gets back to a point that I already made. DPCs need to assume ownership of utilization. If they're getting paid for 50 members but are only seeing 20, they need to fix that, and it should be a priority. All right? Thank you, Leslie, for your words of wisdom. All right, I'm going to end here. So, again, the reason that I am pushing this is because this is a flywheel. The more employers who get into the game, that lean into hard conversations, that educate themselves, that push other employers to get in the movement, right, is number one, is going to cause more providers to open up practices, to bundle their services, to get into the game, right, which is going to lead to more brokers, consultants, educating on the movement, aligning incentives, owning the employer education, right? I am putting this on you guys. Like, we will do as much as we can to help push this movement forward, but I truly, truly need all of you in the room to make that happen. Just a brief shout out on this. For those that haven't seen, I did a recent podcast on relentless health value. So relentless health value is many of you in the room kind of learned healthcare from this podcast. I did a recent one, actually another episode just came out this morning, where I spoke to this concept, this like flywheel. So number one, like kind of part one was like, what's wrong? And then part two is how do we fix it, right? So those that you listen that way, take a look at that. I think I'd encourage you to just learn, listen more, get an understanding. So let's finish where we started, right? Which is that ultimately we see what is broken, right? We see that to be a part of the change, again, I need you all. We all need to be active participants in this. And I hope that you can embrace the crudeness, but also the spirit of what we are trying to do. Like, this whole thing is very messed up. It's very entangled. But what gives me so much hope is that we have the power. This is not out of our hands. This is not something that is addressed in a distant land, right? This can be addressed right here by you people, everyone in the room taking action and driving the things that we ultimately want to see. So with that, thank you for listening to me. I know that was a lot, but appreciate it.